Hi, I'm Tony Williams, and this is Brooklyn Savvy. Hi, I'm Tony Williams, and welcome to Brooklyn Savvy. We have a wonderful show lined up for you today. It is on COVID and vaccines that's targeted to African Americans. But before we get started, let me introduce who is in the room. I'd like to start with Yolanda Richard. She is of FPWA and largely responsible for the Roll Up Your Sleeves campaign. And then we have Dr. Monica Sweeny. She is a professor emeritus of public health, and she's just wonderful. And let me also just give a shout out to my Brooklyn Savvy panelistas. We have Dr. Maria De Longoria, and we also have Phyllis Whitethorn. So let's kick it off with a question to Yolanda. Talk to us about this Roll Up Your Sleeves campaign and the difference that you want to make in the African American community. And I think this is a statewide campaign, if I'm correct.
Yes, Tony, it is a statewide campaign. And thank you so much for having me on Brooklyn Savvy. It's truly an honor to speak to your audience about the Roll Up Your Sleeves campaign. And so, in a nutshell, Roll Up Your Sleeves is a commitment to the preservation of Black life in New York. And so FPWA launched this Roll Up Your Sleeves campaign to provide verified information to Black communities around COVID-19 and the vaccine, and also, information that is curated for our communities that is culturally appropriate. One of the things that we saw that was lacking in the field is, vaccine information that was directed to the Black population that talked about things that were happening in our communities and didn't perceive Black people as a monolith, right? And so our campaign is rooted in the fact that Black people are a diverse group of people, that we have African Americans, folks who identify as African, folks who identify as Afro-Latino, Afro-Caribbean, and each of us have our own perspectives when it comes to the vaccine. And the heart of the campaign is to address that.
Can you speak to us around verified? When you say verified, what do you mean?
So we lean on information that comes down through the CDC, through New York State's Department of Health, and we also lean on New York City's Department of Health. And so, that is distinct and different from the resources and information sources that many of our community members are connected to, whether that comes through social media or family and friends that are sort of passing around misinformation. Our campaign and our organization historically at FPWA, we've been trusted leaders in the space of bringing factual information to public policy and understanding poverty and community need in New York City. And so we lean on verified information and we bring that into the community.
Yeah, I'm wondering, Dr. Sweeny, if you can speak about this. There is this word called vaccine hesitancy among African Americans. Do you think that as a group, we are reticent when it comes to protecting our health state?
I have to tell you that the data does not support, the statistics do not support vaccine hesitancy in all of the groups, age groups in particular of African Americans. This whole thing about hesitancy has taken root, but the data does not support it overall. Now, are there groups that are more hesitant than others in the Black community? And the answer is yes. And the young people are much more hesitant than the older people. When I got my vaccine, there were as many Black people in there as there were white people, and in a huge setting. And the data supports this. The older Black people, knowing that they're vulnerable, they turned out to get vaccinated. younger people have many reasons that they're hesitant, and they don't know anything about, and you don't hear them saying Tuskegee either. It has a general distrust of the government, the information that's being out there. One group that I did sort of a little bit of a survey, unofficial, non-scientific survey. And so they said, we didn't know what to believe. They say, you can take off your mask and you can't take off your mask and you don't need a mask. You should get vaccinated if this, that, and the other. And so having conflicting information is another reason people are hesitant.
Yolanda, we've talked about hesitancy and deliberate. Can you talk about why we're changing our language somewhat around that?
Yeah, so I find some of Dr. Sweeney's comments really interesting, right? Because when we look at the state data, I think that you are right that we are, many of the same reasons why the Black community is hesitant is similar to other communities, but the data that we're seeing actually is missing race-based data for vaccinations of upwards to 4 million individuals. And so we actually don't know that 70% is actually still a remaining question mark concerning Black vaccination rates. And so, with that, I think our campaign sort of continues to caution, continues to look into the needs and the voices that are present in Black communities, and and to continue to address those and not sort of say, hey, we've met the statewide average, and so the work is done, right? No, the work still needs to continue to answer the specific concerns that are in our communities. And so in terms of, the difference between hesitant and deliberate, I think that we want to, sort of take a deliberate approach when we move into communities, and not necessarily, as you said, Dr. Sweeny, assume that folks are not necessarily engaged in vaccine education or learning about the vaccine, for themselves, and sort of, giving them the space, giving them the time to make their own decisions around those questions, and not sort of, placing certain labels on the community that they haven't identified for themselves, or self-identified as being hesitant, right? And so they're more so wanting to take deliberate, thoughtful action toward their health, and we're providing them the resources to do that.
Phyllis, what did you have to contribute?
Well, Dr. Sweeny mentioned that many of those that are hesitant are the younger people. And that's been my experience too, as I've been speaking to my granddaughter, her friends, my daughter's friends. I've gotten a lot of pushback to the vaccine from them. So I was wondering how the Roll Up Your Sleeves campaign, how are you addressing that with them? What are some of the things that you're doing to help them to make choices that are better for them, that would serve them better? And I know when I talked to my granddaughter, she mentioned to me that, I said, so where did you hear all that? And she's talking about social media. She's talking with other friends that are using social media as the same resource.
Yeah. So our campaign addresses, different parts of the Black community, and the primary way we do that is how we've structured the campaign. So we've actually re-granted funds to about 42 nonprofit and community-based organizations, many of them being houses of worship, who are directly connected to community members. Many of those organizations do operate youth programming, do support young people, run daycare centers. And so we were really intentional about selecting organizations that had a direct connection to different parts of the Black population. And so, our grantees are crafting specific messaging to those groups and also empowering youth to create their own messaging around the vaccine that they can share with their friends and family. But on the other side of the campaign is our statewide media push. And so we are planning on engaging our social media folks, right? Our social media influencers, folks that, young persons typically connect to online, and sort of trying to disrupt the flow of information that's coming through on, YouTube, on Instagram, Facebook, et cetera, with, again, culturally appropriate Black branding material that's targeted to our population and our demographics. We also have community testimonials of young people who have taken the vaccine that we're disseminating throughout the community as well, so that folks can know, hey, yeah, I'm of this age, I'm 15 or I'm 19 and I took the vaccine, and you can too. And so, we have all of these different push points and places where we're trying to engage. But in terms of youth, I think a lot of, one of the places that we are wanting to engage more is the not only the public school system, but the charter school system. A lot of Black youth in the city are connected to charter schools. And so, looking at ways to, to connect with those communities as well is a priority of this campaign.
Why is it that folks can't get information first? Why is it that young people are choosing to listen to an influencer as opposed to a health professional? What is driving that? And I noticed that we've spoken before in preparation for the show about frames. Can you talk about that a little bit, about people's attitudes?
Yeah. So in our campaign, we discovered, and in our research for the campaign, we discovered that there are three sort of avatars or frames of mind that folks who are still hesitant take on. So the first frame is the access frame. So the person that doesn't have a negative relationship with the vaccine, but they might have concerns of, where's the vaccination site, or can I actually access the building that this vaccine is being held in, right? If they have, a disability, or they're not able to go into specific spaces. And the second sort of person that we're seeing in field is the person who is more so apathetic. We call them the waiters, right? The folks who are waiting and seeing to, how other people are faring with the vaccine, but they never quite get to the place where they want to get vaccinated, but they're still waiting. Many of those, believe it or not, are sort of being swept up in this mandate wave, and being required to take it. And so those who are sort of moving along with the mandates, we likely put them in that category, the apathetic crowd, because waiting time is over. And so the last sort of group of folks that we're seeing are the truly mistrustful, the truly hesitant. I don't, believe in, trusting in government. Very, very much so knowledgeable about the relationship between government and persons of color in the country, and sort of leaning on that history, to make decisions in the moment. And, those who are sort of really invested in the narratives that are being spun on social media, that are being spun within community between family members and different experiences, and things that you're sort of hearing around. And so, those are going to be like the hardest folks to really provide, this vaccine access to. But, so within these three frames, the idea is that you don't come to the table, or you don't come to those conversations with these three different sorts of people with any level of judgment, but you come from the place in which they stand. You come assuming the reality in which they live. And then you have a conversation from that reality. And I think many of us have had conversations with the truly mistrustful, and our realities are so different because we are, we would go to our doctors and believe what they say. Whereas someone who may not fit into that category would rather trust a shaman, or they would rather trust natural remedies, right? And they don't spend much time at the doctor's office. And so there's so many sort of varieties of different ways that we end up approaching folks, but those frames really do help us to have conversations that produce fruit in field.